misinformation has become so pervasive that folks have incorporated it into their identity. And that's a much more difficult thing to overcome.
And almost inevitably, something will be brought up that is just not factual. And so it does play a major role for most people.
We could know as soon as this week if the federal government will approve a vaccine for younger kids. And as we edge closer, Maine doctors are still getting questions around a common claim that the mRNA technology in the Pfizer and Moderna shots is new or experimental. That's false. Let's verify. Let's start with the claim. Is the mRNA technology in the Pfizer and Moderna COVID-19 vaccines new?
One concern that I hear most often is just simply about the newness of the vaccine.
Our sources are Maine CDC Director Dr. Nirav Shah, Northern Light Health Senior Physician Executive Dr. James Jarvis, Maine General Health's Chief Medical Officer Dr. Steve Diaz, and the US CDC. All four say no, the technology is not new and has been studied since the 1970s.
But it's not brand spanking new. It's been well tested for decades.
It has been used in other applications before. It was just new, meaning that we didn't have this virus before, so it was created for this particular virus.
The best thing that folks can do to stay out of the hospital with COVID is get vaccinated, without question.
The US CDC explains a little more. The mRNA vaccines do not contain any live virus and cannot cause someone to get sick with COVID. Messenger RNA vaccines teach our cells how to make a protein that will trigger an immune response inside our bodies. Our cells break down mRNA and get rid of it within a few days after vaccination. So here's the next claim. Are the vaccines experimental? That's false. The US FDA and CDC scrutinized the vaccines and made the companies submit the same data as they would for authorizing any other vaccine.
But emergency use authorization does not allow any step to be skipped, not fulfilled. It is the same process as with anything else.
How quickly they were approved is thanks, in large part, to the CDC staff under the Trump administration.
It's gone through all the appropriate steps to verify that it works, that it has a safety profile, that it's going to be continuously, it's in all the things that other medications and vaccines go through, no differently, that we do not call experimental. So no, it's not experimental. It's not brand spanking new. The scale is, and it's not experimental.
So we can verify the claims that mRNA vaccine technology is new or experimental are both false. If there's something you want us to verify, reach out. Email verify@newscentermaine.com, or you can connect with us on social media.